I'm Vicki Hogarth at the CHCO News Desk. We will be starting the COVID-19 briefing shortly with Dr. Russell, Premier Higgs, and Minister Shepherd. Today we expect to be hearing about potentially more restrictions that could be put into place, not necessarily restrictions, but more guidelines, I should say, to actually qualify it properly. We expect that they will have more guidelines to stop the spread of COVID-19. Obviously, we are seeing record numbers of daily case counts. This past week alone, we've hit 76 cases, was a record daily high. That was on Sunday. Dr. Dow in the last conference mentioned that with new guidelines in place, such as the proof of vaccination, plus as the mask mandate, which we saw start this Wednesday, both of those started together on Wednesday, that when we do see the numbers slow down because of those guidelines put in place, he said it takes about 2 weeks to see any effect of that. So we will likely, even though these new things have been put in place this week, we likely will not see a change in terms of a drop in case count for about 10 days to 2 weeks. That's what he said, and honestly, it makes sense. He said you have to factor in the incubation period of disease, how many people get sick, that spread will continue on, and so on. So please, again, if you have questions for Dr. Russell, Premier Higgs, or Minister Shepherd today, please feel free to email me, or news@chco.tv. It's just the easiest. Everyone on the news team gets that. And by everyone, I mean about 3 of us. Or you can write the questions right on our Facebook comment section. Again, I'm monitoring it as best we can. I do think potentially someone else from CHCO who is working outside of the office is monitoring
Good
as
afternoon,
well.
everyone, and welcome to
Sounds like we're about to start the conference, so I should be going over to a video feed. Obviously, we get the conference when you call in on the phone. We start a little bit sooner than you are able to access the video too, so just hang in there, and we should be going directly to the conference in about 30 seconds from now. Please write your comments and your questions for the Premier in the comment section on Facebook if you're following online, and I will see you after the conference.
Update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont dans l'ordre suivant sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, le ministre de la Santé, Dorothy Shepherd, et le Premier Ministre Blaine Higgs, speaking on behalf of the province today in the following order. Dr. Jennifer Russell, the province's Chief Medical Officer of Health, the Honorable Dorothy Shepherd, Minister of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell?
We've been sitting here.
Good afternoon, everyone. Bonjour à toutes et à tous. Et aussi à tous les journalistes qui sont ici.
And also to all the journalists who are here in the room today.
Bad duty to inform you that 3 more New Brunswickers have passed away as a result of COVID-19. This includes a person between the ages of 70 and 79 from Zone 1, a person between the ages of 80 and 89 from Zone 1, and a person over 90 years of age from Zone 4. Each of these individuals has a family and friends who are now mourning their loss, and I join all New Brunswickers in sharing my heartfelt condolences with everyone who has been affected by these tragic deaths. This brings the total number of COVID-19 related deaths in the province to 52. Aujourd'hui, j'ai le triste devoir de vous informer que 3 autres personnes du Nouveau-Brunswick sont décédées.
I must now announce that 3 more people, New Brunswickers, have passed away as a result of COVID-19, and this includes a person between the ages of 70 to 79 from Zone 1, a person between the ages of 80 and 89 from Zone 1, and a person over 90 years of age from Zone 4. Each of these individuals has people and friends who are now mourning their loss, and I join all New Brunswickers in sharing my heartfelt condolences with everyone who has been affected by these tragic deaths.
who participated in the technical briefing for providing us with the important information about how COVID-19 is currently impacting our province. And for those who watched, I hope there is now a better understanding of the bigger picture in New Brunswick. It is clear that our current situation is very serious. If you did not see it, then you'll be able to watch it later on the Government of New Brunswick's YouTube channel. Throughout the COVID pandemic, we have acted to protect New Brunswickers. We have also acted to preserve the healthcare system that we all depend upon. And we have not hesitated to take action to limit the spread of this virus, and we will not hesitate now. The situation we are facing with the fourth wave of COVID-19 is very serious. It affects all of us, old and young, rural and urban, vaccinated and unvaccinated. We knew there would be more cases of COVID-19 after the mandatory order was lifted in July. We expected to see an increase in infections as people moved around the province and the country. But the pace of this fourth wave is beyond what we had anticipated. La quatrième vague de COVID-19 nous place dans...
The fourth wave of COVID-19 is very serious. It affects us all, old and young, rural and urban, vaccinated and unvaccinated. We knew there would be more cases of COVID-19 after the mandatory order was lifted in July. We expected to see an increase in infections as people moved around the province and the country. But the pace of this fourth wave is beyond what we had anticipated.
Being fueled by the Delta variant, which is more contagious than the original version, as mentioned by Dr. Gordon Dow. Without further action, we will see an even greater number of cases in the coming weeks, and even more New Brunswickers requiring hospital care. We are now at that tipping point. By acting now, we can stabilize the spread of the virus and reduce the strain on our healthcare system. Everyone is impacted by this fourth wave. Therefore, everyone needs to be part of the solution. Now, there may be some of you who believe that COVID-19 has become someone else's problem. If you are vaccinated, you might be feeling secure that you are protected against COVID-19. And it is true that vaccination does significantly reduce the risk of severe illness, hospitalization, and death, but the risk is still there. You can still catch COVID-19 and pass on the virus to the vulnerable, the elderly, and unvaccinated children. If you remain unvaccinated, perhaps you believe this disease will not affect you because of your age or current health status. But the greatest risk affects us all equally, and that is the risk that COVID-19 presents to our healthcare system. For the past week, we have been averaging around 67 new cases per day, with hospital admissions rising by 1 patient per day. Today, there are 78 new cases of COVID-19 in New Brunswick, and the full list will be on the GNB website, but I can tell you that we are seeing new cases in nearly every corner of our province. Et la plupart de ces cas nouveaux.
And most of these new cases are amongst the unvaccinated. And at the current pace, by next week, we will be averaging up to 72 new infections each day, with an additional increase in severe illness and hospitalization.
Fourth wave, just as we did in the first 3 waves of this pandemic. Depuis une semaine, nous signalons.
For the past week, we've been seeing 65 cases per day on average, with hospital admissions rising by 1 patient per day. Today, there are 78 new cases of COVID-19 in New Brunswick, and the full list will be on the GNB website, but I can tell you that we are seeing new cases in every corner of our province. Most, but not all, of these new cases are amongst the unvaccinated. At this current pace, by next week, we will be averaging up to 72 new infections each day, with an additional increase in severe illness and hospitalization. We can turn the tide on this fourth wave, just as we did with the first three waves of this pandemic.
Is to get fully vaccinated. Our vaccination rate continues to rise slowly, but we still need more. And again, I ask that every New Brunswicker who is eligible to be vaccinated get their vaccination as soon as possible. With more infectious strains of the virus now in our province, we need every eligible person to get vaccinated. This is how we will slow the spread and reduce the number of active cases and hospitalizations. We announced this week that individuals who are immunocompromised are now eligible to receive a third dose of an mRNA vaccine. These additional doses will provide people who may have a reduced immune response to COVID-19 vaccination with better protection against the virus. Nous avons annoncé plus tôt.
We announced earlier this week that people who are immunocompromised are now eligible to receive a third shot of an mRNA vaccine. These additional doses will provide people who have a reduced immune response with better protection against the COVID-19.
For this third dose of Pfizer-BioNTech or Moderna vaccine is at least 4 weeks after receiving a second dose. Vaccinated or not, observing public health measures will also help to reduce the spread of COVID-19. We all need to maintain several layers of protection against the virus. Masks are again mandatory in indoor public spaces, and I'm greatly encouraged to see so many of you are taking this seriously. Masks will help prevent the spread of infection, and that will save lives. It also remains important to wash your hands regularly and thoroughly. And if you don't feel well, stay at home. Watch for symptoms of COVID-19 and seek testing if they appear in you or a member of your family. These are the tactics we all learned during the first year of the pandemic. Please keep using them. Due to the major surge in the number of COVID-19 cases, I'm aware that we are experiencing major delays at our assessment centers throughout our province. And I want to acknowledge that the significant demand for COVID-19 testing is leading to longer than anticipated wait times to schedule an appointment and to receive test results. Wait times for testing varies depending on the location. Urgent requests are being booked within 24 hours, while others may have to wait a few days to receive an appointment. Je tiens à signaler que l'importante demande.
I have to say that I want to acknowledge that the significant demand for COVID-19 testing is leading to longer than anticipated wait times to schedule an appointment and to receive test results. Wait times for testing varies depending on the location, and urgent requests are being booked within 24 hours, while others may wait a few days to receive an appointment.
Are looking to enhance staffing resources at these locations to help reduce wait times and processing times. We are asking our partners to find ways to increase both hours of operation and capacity to help alleviate the longer than normal times for testing. Nous demandons à nos partenaires.
We are asking our partners to find ways to increase both hours of operation and capacity to alleviate the longer than normal times for testing.
I ask that you please be patient with people working at the assessment centers. They are doing everything in their power to test people as quickly as possible and provide results in a timely manner. After learning more about our current situation, it's understandable if you're concerned about what this means for your children, especially those who are attending school. I want to assure you that public health is committed to keeping every classroom and every teacher and every student healthy and safe, and we work very closely with our partners at EECD to ensure that we stay in close contact about the situations as they evolve. While we are seeing children under 19 contract this virus, for now those numbers remain low, thankfully, and none are currently hospitalized. And as Dr. Dow alluded to, generally we don't see children becoming so ill that they require hospitalization, but we know that it can happen. And this is why we have the measures in place that we have currently. For the most part, infections of students occurred outside of school in gatherings of family and friends rather than in the classroom. And we all must do our best to keep our lives running as normally as possible. And again, public health measures should never exceed the risks, and we've always been trying to balance that no matter the situation throughout the pandemic. We know the benefit of keeping children in the classroom goes a long way, and the positive impact it has on their overall well-being, social and mental health. Again, we've always taken into account the social determinants of health with our public health recommendations and measures. We know that COVID-19 will continue to be with us for some time. Masks and other restrictions may continue to be necessary in the months ahead as the Delta and other variants move through our communities. In time, we will move beyond this pandemic, hopefully, although we don't know how many years it will take. But as Dr. Bonnie Henry referred to recently in an interview, that we'll be living with this for some time. We will get to the point, hopefully, that we're able to live with this virus in the least invasive way possible, but that's hard to determine and measure at this point. But what we will continue to maintain and manage is our healthcare system and preventing it from becoming overwhelmed. So to reach that point now, more than ever, we need to remember that we are all in this together. And that is a really difficult thing to think about right now when people are stressed and concerned and anxious. But it has worked in the past. We've gotten this far, and we all must continue to work together to turn this tide of this fourth wave. Thank you very much. Merci.
C'est comme tu veux.
Good afternoon, bonjour. Before we begin today, I would like to offer my sincere condolences to the loved ones of the 3 people who have passed away as a result of COVID-19. Learning that 3 New Brunswickers have lost their lives to this virus in a single day is tragic, and I know we are all feeling the impact of this shocking news. My thoughts and prayers are with the family and friends of these individuals during this difficult time. These past 3 weeks have shown us that COVID-19 and the variants of concern are not going away easily. Given the opportunity to infect hosts, this virus will continue to spread. We are now experiencing a surge unlike anything we have witnessed in our province. In a short time frame, we have gone from a very manageable 10 cases a day to an average of 67 cases per day, and we expect that number to continue to rise. It's concerning, it's upsetting, and it's frightening. Despite the successes we've had in the past, we must now recognize that COVID-19 is a virus that will manage to find the weakest link and impact our healthcare system, something we have worked so very hard to prevent. The majority of New Brunswickers have done what we've asked them to do, but it is clear we need to take extra measures and precautions to regain the upper hand. The information already provided during today's technical briefing and by Dr. Russell, and the further details that will be delivered shortly by the Premier, empowers us with the knowledge that once again, we can stifle this virus. Today, our government's top concern is the impact COVID-19 is having and will continue to have on New Brunswick's healthcare system if this fourth wave continues on its current trajectory. Our healthcare system is fragile, and we are aware of its challenges and vulnerabilities. We know that treating a patient with severe illness caused by COVID-19 requires more resources than treating patients hospitalized with other illnesses. A patient in the ICU with COVID-19 often requires one-on-one 24-hour care. In most cases, even if the COVID-19 patients are not in ICU, they require oxygen and will need one-on-one nursing care. A recent report by the Canadian Institute for Health Information showed that people who are hospitalized with COVID-19 typically remain in hospital for approximately 15 days, which is twice as long as a typical pneumonia patient. In addition, The report found that the average COVID-19 patient in the ICU stays in hospital for 21 days and is much sicker than other patients. COVID-19 patients who recover after being on a ventilator often require treatment from multiple health professionals, such as physiotherapists and respiratory therapists. If the number of cases, hospitalizations, and ICU admissions continue to rise, it will impact all New Brunswickers. If our hospitals become overwhelmed, we will need to cut back on other healthcare services, including regular appointments and routine surgeries. In a worst-case scenario, healthcare professionals would need to make heartbreaking decisions about who to care for, and some patients could be turned away. Our healthcare workers are already feeling the strain, as are contact tracers and other public health employees. We know that the likelihood of becoming severely ill from COVID-19 is much lower among the vaccinated. I continue to urge anyone who has not yet been vaccinated to book an appointment right away. The vaccine is the very best tool we have to protect from severe illness if we have been exposed to COVID-19. This week, our government introduced new measures to slow the spread and encourage higher vaccination rates. We now need to wear a mask in indoor spaces, register our travel when entering New Brunswick, and show proof of we are fully vaccinated when accessing certain businesses, services, or events. Due to the rising number of cases and hospitalizations, Public Health has recommended some additional regulations to further protect New Brunswickers, and Premier Higgs will provide more details about those measures in just a moment. There have been many times throughout this pandemic when we've needed to take a step back and reconsider our response. With the guidance of Public Health, we are constantly assessing our approach and making appropriate adjustments as needed to ensure we are doing what is necessary to protect New Brunswickers, while also trying to live our lives as normally as possible. We have managed to turn things around time and time again as we've moved through the waves of the pandemic. I am confident we can get back on track once again by working together and following the rules that are put in place. Please continue to do your part to protect yourself, your family, your friends, and your neighbors. Thank you. Merci.
Good afternoon. Bonjour. Marcia and I were saddened to learn that 3 New Brunswickers have died as a result of complications from COVID-19. On behalf of all New Brunswickers, I want to offer my sincere condolences to their family and friends. Please know that our thoughts and prayers are with you as you grieve these tragic losses. As both Minister Shepherd and Dr. Russell explained, the situation we currently face in New Brunswick is indeed serious. That is why, on the advice of Public Health, Cabinet is reinstating a state of emergency and bringing in a mandatory order as of 11:59 p.m. tonight. This is in addition to the Public Health Act measures put in place on Wednesday. Under the mandatory order, there is a return to household bubbles, which will include your household plus up to 20 consistent contacts. The steady 20 we have had earlier this year. Lorsqu'un preuve de plan
When with a proof of vaccination is not necessary to enter a business, an event, or a service like going to the grocery store or private businesses, social distancing of 2 meters is required.
Gatherings are limited to your 20 consistent contacts. Businesses and events where people gather or exercise, including museums, movie theaters, bingo halls, amusement centers, arenas, weddings, and funerals, must ensure all employees are fully vaccinated or continuously masked and tested regularly. Les entreprises du Nouveau-Brunswick
Businesses here in the province of New Brunswick, in fact, can get information regarding the access, regarding quick testing for their employees by contacting the Chamber of Commerce of the region.
that all participants show proof of full vaccination, or they may choose to implement alternative public health measures to protect congregants from COVID-19. These measures include operating at 50% capacity, the continuous use of masks, maintaining 2 meters of physical distance between attendees from different households, no congregational singing, either recording the names of attendees and gather contact information by row or pew, or having a consistent assigned seating plan for the purposes of contact tracing, and preventing parishioners with COVID-19 symptoms and those who have been instructed to self-isolate from entering the venue. En plus de vaccination complète est exigée.
Full vaccination is necessary for funerals, for weddings or special services, and no social gathering is authorized. Just as long as physical distancing can be maintained. There are no limits for gatherings outside.
It is unfortunate to return to a state of emergency. However, it is necessary. Our province must take these steps now. We need to slow the spread of COVID-19 and ensure the number of hospitalizations does not continue to rise. The current rate of growth in cases of COVID-19, and especially of hospitalizations due to COVID-19, is a serious and imminent risk to public health in New Brunswick, to the health and safety of all New Brunswickers, and to the continuity of function of critical health services in New Brunswick, and constitutes a public health and healthcare emergency. We need all New Brunswickers to take urgent action, regardless of vaccination status, to slow the spread of COVID-19. That is why these measures and the return to the mandatory order are required. The situation is serious, and we need people to take it seriously. L'arrêté obligatoire sera revu.
The mandatory order will be reviewed every 2 weeks. Just like we did since the beginning of the pandemic, we will continue to monitor the situation and work closely with public health in order to find the best way of doing things.
Mr. Shepherd explained, our main concern is the impact COVID-19 is having on our healthcare system. That is why hospitalizations are now the trigger for us to move back and forth from public health measures to the mandatory order. The mandatory order will come into effect when we have 25 or more people hospitalized due to COVID-19 in New Brunswick, a situation we are in today with 31 in hospital. We must do this because of the strain this number of hospitalizations puts on our healthcare system. As hospitalizations decrease, the mandatory order and the public health measures will remain in effect to ensure hospitalizations stabilize. L'arrêté obligatoire sera levé.
The mandatory order will be lifted when the number of hospitalizations in the province will be at 10% or lower. Once this happens, the province of New Brunswick, in fact, will put in place the measures that are already in place today. These measures are necessary so that the number of hospitalizations because of this illness be manageable.
Of COVID-19. It is not about case numbers. It is those cases that lead to hospitalizations and threaten our entire healthcare system that are of a concern. Right now, 31 people are hospitalized and 15 people are in ICU due to COVID-19. 27 or 87% of those people are not fully vaccinated. Of the 37 people who were hospitalized between July 1st and September 22nd, only 5 were fully vaccinated, while 3 were partially vaccinated. 29 or 78% were unvaccinated. While people age 40 and older who are unvaccinated have accounted for 33% of the total number of COVID-19 cases in New Brunswick since July 1st, they have represented 83% of hospitalizations. I'm talking people 40 and over, many 40 to 50. Above 60, we're in a range where almost 90% are fully vaccinated. This pandemic has constantly changed and is imperative that we are able to adapt as well. Having the ability to move back and forth between public health measures and the requirements of the mandatory order gives us the flexibility we need to face these challenges while keeping our healthcare system in balance and to live life as normally as possible. If you choose not to follow the rules and put your fellow New Brunswickers at risk, there will be consequences to your actions. Spot checks will be conducted at the borders and at businesses, and fines will be issued. Under the mandatory order, for each instance of noncompliance, the minimum fine is $480 and the maximum fine is $20,400. Unfortunately, some who choose not to be vaccinated have also been shown to be less likely to self-isolate when required to do so, or get tested, or wear a mask. Vous êtes bien sûr libre de...
Obviously, you're free to make your own decisions, but measures need to be put in place in order to protect the community when these decisions put other people in danger. As the situation has become a pandemic of those who are not vaccinated, the greater number of active cases are high, and the risks are higher for people who are contaminated. And those who do not get vaccinated or can't be vaccinated are at risk.
Times more likely to be hospitalized than those fully vaccinated. While unvaccinated individuals 40 years of age and older are 31 times more likely to be hospitalized than those fully vaccinated. And they make up the vast majority of our current cases in hospitals. If you have not had your first or second dose of COVID-19 vaccine, I urge you to go to a walk-in clinic or book an appointment through a participating pharmacy or a Vitality or Horizon Health Network clinic as soon as you possibly can. Plus le nombre de gens vaccinés est élevé,
the greater the number of people who are vaccinated, better we increase our chances of getting out of this. I truly appreciate that for those who got vaccinated. In fact, this is an important step that they took in order to protect themselves and protect their loved ones.
I appreciate that so many of you are choosing to follow the measures now in place, and that you will continue to follow further restrictions under the mandatory order when they go into effect at 11:59 p.m. Everything you are doing is having an impact. You get to choose what kind of impact that will ultimately be. None of this is easy, but we will get through this the same way we have gotten here thus far, by working together. Thank you. Merci.
Merci, Monsieur le Premier ministre. We'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. Andrew Waugh, Brunswick News. Tom Bateman, Brunswick News.
Hi, can you hear me?
Little louder, bud.
How about now?
Perfect.
Great. So listen, we heard last week about some strain on contact tracing capacity in this province. And I think Dr. Dow's presentation kind of framed that in interesting terms. Dr. Russell, how many people are doing contact tracing in the province right now? And can you explain whether we need more capacity in contact tracing and how that will be achieved? Thank you.
Hi, Tom. There's no question that it is a challenge right now with respect to the number of people that have COVID and their high number of contacts in the different settings. But it really is our top priority right now. And it is a multifaceted process because we have public health folks that work on it, not just the nursing staff, but we've got inspectors working on it. And we have multiple partners from extramural, Ambulance New Brunswick, education, and early childhood, and we also have at the federal level the Stats Canada folks who help us with that as well. This recent surge really has obviously stretched the resources, there's no question. And so we are also including partnerships with EECD staff to help with the distribution of public health directives to contacts in the school system. And since the beginning of September, we have had added more interviewers, including approximately 30, I just mentioned that from the Statistics Canada program. And we will continue to assess and onboard any other available resources right now to assist with contact tracing. And I guess for the public, it's really important that if you do receive a notification from public health, either by way of letter or phone call, it is important that individuals comply with those directives to self-isolate, et cetera.
Thank you, Doctor. Thank you, Mr. Bateman. Bobby Jean McKinnon,
Get a
CBC.
follow-up, Bruce?
I'm trying to squeeze everybody in. Bobby Jean
Yeah.
McKinnon. Bobby Jean. Sarah Seeley, Brunswick News.
Can you hear me?
A little louder, but yes.
Thank you. Dr. Russell, how many of the unvaccinated cases involve children under 12 who are too young to be vaccinated? And how many involve people who can't be vaccinated because of medical or other conditions? And why doesn't the province provide these figures routinely on the dashboard?
Yeah, I think what we provide on the dashboard in terms of the breakdown, it's usually as a percentage, but and the way we present the data is, I think, pretty similar across the country. And I'm not sure if Mathieu Chariflou presented the information on how many cases of COVID in terms of cases that are vaccinated versus unvaccinated. I know he showed a slide of all of the cases in terms of which ones are vaccinated, but I don't have the breakdown in cases of vaccinated versus unvaccinated the way you're asking for.
I'm going now to Sarah Seeley, Brunswick News.
Can you hear me?
Yes, Sarah, go ahead.
Excellent. My question is for Mr. Shepherd. I was just wondering if the province was aware of the impact of the surge in cases on emergency departments and what actions are being taken to address that.
I think Dr. Dow, or Dr. John Dornan, interim CEO at Horizon, spoke very well about this, in that absolutely COVID has an impact on every area of our hospital system right now. So at the ER in particular, I think our biggest challenge with the ER is, of course, COVID protocols, but also staff. It has been a challenge all summer long. We knew it would be a challenge. We knew that we would be continuing to be challenged in this area. And so the RHAs are, of course, tasked with making sure that they can keep their services at a safe level for employees and for patients visiting. So the RHAs will make any decisions they need to make in order to protect their staff and the patients who are coming there for service.
Thank you, Minister. Frédéric Camarano, Radio-Canada.
Louise Rodriguez, Radio-Canada. Catherine Allard, Radio-Canada.
Brad Perry, CHSJ.
Brad Perry, CHSJ.
Andrew Waugh, Brunswick News.
Can you hear me?
Perfectly,
Yeah, can you hear
bud. Yep.
Okay, thank you very much. Premier, I listened to what you just, your opening remarks, and we just listened to Dr. Dow say that it was a mistake to reopen on the 30th of July. You've recently said you wouldn't do anything differently. Now we've got these cases rising, we've got these new measures. Do you have any regrets? Do you feel like you need to say sorry to New Brunswickers for the situation we're now in?
I am obviously not very happy about the situation we're in today. And my comments previously about the decision made back in July 31st was based on the facts that we had available to us and where we were in the pandemic of the time. It was the right thing to do for New Brunswick. It was the right thing to do in relation to us getting to see family again and to have a summer back with family, as we don't know how long this is going to ultimately last. And so to get a reprieve, and we had been in a good position in our province for some time. So I know it's convenient to try to get a gotcha moment here, but my point is this: with the facts that were available at the time, and with us looking at where we were as a province at the time, I would have made the same decision then that I did. If you look back and you say, well, in hindsight, would you have done anything differently? Well, you know, there's probably through my life, there's lots of times in hindsight I would do things differently. And yes, could this be one of them in hindsight? But I have to reiterate that the decision we made at the time were based on the facts available and the situation our province was in and how we would go forward. It's always easy to look back. So right now, we're reacting to the situation we're in. As you know, this really kind of came after September, a long weekend, and then it has ramped up quickly, and that's why we're taking these measures quickly, and we'll continue to do that as we've done. But we have acted as a team throughout this entire pandemic, and we faced it together as all New Brunswickers, and we will continue to do that, and I'm confident, just as we've survived the first 19 months, we will get through this, and we will be diligent in doing whatever's necessary to protect the citizens of this province.
Thank you. We're going to cycle through questions real quickly. Tim Roselle, Global.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, just given that the restrictions that are coming into effect under the mandatory order, you know, we've got the steady 20 reinstated with households, limits on indoor gatherings and things like that. How challenging is it going to be, and how can you sort of rationalize doing that while leaving you know, gyms, sports venues, concert theaters, and things like that open for larger style gatherings?
Yeah, great question. It really is a different situation now based on the fact that we do have a large amount of our population vaccinated. So that's really what we took into account when we made the recommendations about the current measures. It was really based on targeting the higher risk areas where we knew transmission was occurring, predominantly among unvaccinated folks in indoor settings, not wearing masks and no distancing. So when you put that into the equation with the population that we know are vaccinated and the places where we will require proof of vaccination, that's the balance that we're striving for in terms of reducing those risks right now.
Thank you. Allison Sampson. Oh, sorry. Go ahead.
Wondering, at what point would you consider dropping this state of emergency? I know we're just entering it today, but do you have any parameters that you have already considered for this to end?
Yes, we do. It's all based on hospitalizations, and currently we're in at 31. We said the trigger was 25, but going back, we won't reduce the state of emergency at 25. We want to get back to 10, and have that 10 threshold be stabilized. So that'll be the next trigger. Will be a stabilized level at 10 or lower.
Alexandre Boudreau.
Dr. Russell, je me demandais si vous pouvez nous donner un peu plus de détails sur les...
Could you give a little more details regarding the prompt teams? They're in 15 places here in the province. I'm wondering if this has an impact on the services that are being provided. In fact, were they ready to respond immediately? Without a doubt, the work that has been done by the prompt team is extraordinary. And in fact, that there are many places here in the province where we have our prompt teams. There are challenges. What I can tell you, will this change the services that are being provided? I can't tell you. However, I can tell you that they do excellent work. They work very hard, but it's very tiring as well, I have to say that. Jacques Poitras.
Premier, you talked about not being close to the 90% new goal for vaccinations last week, referencing the 86 and some for eligible people. But Dr. Dow said the goal is 90% of the entire population. So I just want to clarify, is that the goal? And how realistic is 90% of the entire population?
Well, Dr. Russell may be in a better position to answer this than I, but it's very difficult to have 90% of the entire population. And considering that we're kind of, hovering around the 12% or 10% that just are choosing not to get vaccinated who could, that's a problem. So I think the thing to remember about a lot of this, we don't have vaccines that are readily available for the younger population, but we're also not seeing the sickness in the younger population. We're not seeing the hospitalization rates. We're seeing very low levels of symptoms. And so that at this stage continues with the variant. So I guess achieving a level of 90% in the entire population, although I respect that is our target, will be extremely difficult.
But 90 doesn't trigger anything because now hospitalizations are the trigger.
Because we realize that our goal has to be, and where are people in the hospital? That's why I emphasize today so much about 40 to 60, really. Because above 60, we're seeing full vaccinations. And the current fatalities we have, there are mitigating circumstances that go with those in many cases. But we have hospitalizations at a high level of individuals between 40 and 60. And those are unvaccinated. So readily available to be vaccinated could have a huge impact on the level of hospitalizations, but are choosing not to.
Thank you. Doug Dickinson, Brunswick News. Vicky Hogarth, CHCO.
Can you hear me?
Oh, hang on, Vicky. Yes, Doug. Little louder, please.
Yes, for the Premier, with the rising cases in the Upper River Valley and Zone 3, what concerns are there for the region? I know there's a lot of churches and places of worship in the region. How important are these new measures for churches?
Doug, Minister Shepherd's coming up to answer.
Okay.
Thank you for the question. So, of course, the Upper River Valley and Dr. John Dornan spoke to that today with regards to the fact that some services have had to be curtailed in the Upper River Valley, particularly obstetrics. We have to continually assess every single day. They have an in-brief and an out-brief to analyze what's happening. With regards to faith gatherings, I first want to say thank you to the faith community. We've had several conversations over this last week to try to find a sweet spot that would really help them be better prepared for their congregations. So I've shared with them last night new policies. And we know that fully vaccinated is the very best congregation, but we also know that the faith-based community, are just innately responsive to anyone who comes to their door. So we have provided the faith community with two options into how they run their services, their weekly services. So any activity going on in their building throughout the week, it will be necessary to have proof of vaccination for people to participate in those, whether they be congregation members or whether they be outside groups who are utilizing the business. But beyond that, for services, for weekly services, they have an option. So they can ask for proof of vaccination. And when they do ask for proof of vaccination, they still must continue to mask at all times. But social distancing won't be required. There is no capacity issue, and singing while masked will be permitted. The second option, if they don't choose to ask for proof of vaccination, and they believe that they could be potentially having someone at their service who is not vaccinated, then they must have everyone masked at all times. They must operate at 50% capacity. They will maintain 2 meters of physical distancing between households. There's no congregational singing. Records of names for all attendees and contact information by row or have a consistent assigned seating plan for contact tracing. And they must prevent anyone displaying COVID-19 symptoms or who have been instructed to self-isolate from entering. This is one strict policy or another strict policy. And thanks to the faith community for helping work with us. This is, I believe, a way that that churches can operate and feel comfortable about what they're doing.
Thank you. Vicky Hogarth, do you have a quick question?
I do. I don't know who it's for, though. Unvaccinated staff are still able to work in businesses where a proof of vaccination is required of the customers. Can you provide us with more details on how and where and when the unvaccinated staff are tested and who's monitoring this in businesses like restaurants?
Thank you, Vicki. We are saying regular testing. So at GNB, that's 3 times a week, but in the private sector world, it could be 3 or 2 times a week. And employees must remain masked at all times while they're on the place of business. So I think, does that answer your question? So the testing takes place usually, I believe, on the premises. The tests are provided by the chamber in your area, in the area for businesses, and they have instructions on how to complete the local test.
Thank you. Pascal Rochenag, Radio-Canada.
Oui, bonjour.
Thank you. My question, I don't know who would be answering it, but it's regarding the bubble concept of 20 people. During the last time we included 20 people from a household. So I'm wondering, what is the definition regarding 20 people? Does that include households in which we are, or the people we're in contact with? Good afternoon. And in fact, if you have people who live in your house, let's say you have 4 people who live with you, so it's a total of 20 contacts for the household.
Around gathering restrictions, Premier Higgs mentioned family bubbles and private gathering restrictions and faith-based gatherings. I was wondering, and it's a little further to what Tim had asked, if crowd sizes at bigger events are facing any kind of limitations. Specifically, a week out from the start of the QMJHL season, arenas are selling at full capacity. Are those games in a week going to be allowed to play for full crowds?
So I'll take that one. As long the events like this now must only accept individuals who provide proof of full vaccination. So capacity is not a problem when you have full vaccination. And so this is how the policy will continue. With regards to the household plus 20, Dr. Dow explained how the contacts of individuals are now, and the potential spread of the virus is exponentially growing. So if we can take our contacts to a household plus 20, then if and when a virus outbreak happens in that household, the number of people that the contact tracers have to track down is much more manageable.
Thank you. Erica Butler, CHMA.
Hi there. I know that the province is distributing rapid test kits to New Brunswick businesses for use with their employees. Will you also use these test kits for schools, daycares, or nursing homes? And if so, how soon will people have access to them?
Hi, yes, at this stage, we are using the point of care testing for businesses. The Chambers of Commerce around the province have been helping us with that. But as of right now, we're sticking with that particular rollout. Can we move to something different in the future? We can definitely have conversations with about that, but right now, we're not using those rapid tests widely in all those different settings, just in that business settings right now. The rapid tests that are used in other provinces, obviously we have access to them here. My understanding is in other provinces there are some shortages. But right now, again, the PCR-based testing is our primary mode of testing for many different reasons, which we've discussed in the past around accuracy, et cetera. But certainly we can still continue to have discussions around further evolution of our testing.
Hidil Ibrahim, CBC.
Thank you, Dr. Russell. It's my understanding that the COVID task force was disbanded in July 15th. Was that because we were going to green, and will it come back now that the emergency order is back on? And was it involved in making the decision to go to green?
The COVID task force was in position until we actually went to green and went and suspended the mandatory order. So now that the mandatory order is back as of midnight tonight, I have extended an invitation to my colleagues and leaders of the other parties to once again reassemble the COVID cabinet group. And at this point, they're contemplating that. We just talked about it yesterday.
Okay, sorry, I was
Thank
referencing the pandemic task force, the one that Dr. Russell was in, and Dr. Dow.
Okay, sorry, the pandemic task force.
So has it been disbanded, and is
Hang
it
on,
going to
Hidil.
be back on?
Hang on,
Okay,
Hidil.
I was just clarifying.
Oh, they heard you.
Yeah. At that time, certainly, again, moving forward after green, my understanding is we weren't going to continue to meet except on an ad hoc basis, and we can definitely revisit that. Certainly having Dr. Dow and Dr. Desrosiers part of the conversation in the technical briefing today was great. And again, it's been great to work with them throughout the last 18 months in that capacity. But we've certainly kept in touch. We've certainly had regular meetings and conversations. If we need to bring back the pandemic task force as we had paused it, then we certainly will do that.
Thank you. Oh, Minister.
The pandemic task force was instrumental in helping us make decisions within the RHAs. And that was really why it was pulled in. And certainly they gave advice and had input every day with our daily briefings, etc. The task force was quite specifically engaged for the purpose of making quick decisions of policy within the RHAs and our nursing homes, long-term care sector.
Thank you. Derek Dubé. Savannah Odd.
In the testing centers, vaccine clinics, and now we're seeing a lot of staff in hospitals off for COVID-related reasons. I'm wondering at what point the province will look to other provinces for reinforcements for staff, and if you're considering calling in the military at this point, and if not now, what would trigger that?
So I'm not a clinical person, but I will say this, is that yes, it's been challenging. And the biggest challenge of backlog right now is in testing. And so we're looking at all options within the healthcare networks to help provide support to our testing centers. At this time, there is no consideration for bringing in the military. And I would have to get counsel from our RHAs, CEOs, and A and B, extramural, public health, to whether or not a measure such as that would be necessary. At this time, we're working through it. We're asking those who have not been asked by public health or are not symptomatic to not consider getting a PCR test right now. Let the backlog clear. If you are symptomatic, of course, call. But if public health hasn't asked you to be tested, then you don't have to be tested, right? If you're in a school that has had an exposure, if public health hasn't told you to get tested, you don't need to get tested.
Sorry, just to clarify, you only want people who are symptomatic to call to get a test? That's the instruction right now?
Those contacts, and that's defined by public health.
Last question to Adam Harris.
To Premier Higgs, knowing how this unfolded, are you now promising to be more cautious in ending protocols? I know you said 10 hospitalizations to remove the mandatory order, but is the message today not that we need to live with restrictions for the foreseeable future?
Well, we don't have any, we have restrictions in place at this point in time that could heighten or could lessen depending on where we are with hospitalization. I think that message has been very clear. And I think throughout the entire COVID experience from the beginning, you know, we've reacted as necessary. We felt that we were in a good position through the summer, and we were right up until I guess certainly after Labor Day, and then the time lapse in between that, and then seeing where we are now. But the triggers are clear, the triggers of hospitalization, and of 25, the triggers that certainly to keep the mandatory order, but it doesn't get relaxed until we get below 10 and we're stabilized below 10. So I'm hopeful that we would be able to get back to our normality, more so than what we're introducing today. But I guess time will tell. We're hopeful this will make a difference for sure. We're confident that it'll have to make some difference, and we'll go deeper if necessary. But right now, I guess the message is consistent. If we can get those 40-somethings, 50-somethings completely vaccinated, it'll have a huge impact on our hospitalization.
Thank you, Premier. Thank you, Dr. Russell. Thank you, Minister Shepherd. Merci beaucoup à tout le monde.
That concludes today's COVID-19 update for New Brunswick with Premier Higgs, Dr. Russell, and Minister Shepherd. Obviously, a record-breaking day, 78 new cases of COVID-19 in the province today, as well as 3 new deaths to the virus. The mandatory order, the emergency order, will be back tonight at midnight, along with now reintroducing the steady 20 of close contacts plus your household. Once I have all that information in the form of a press release, I will put it on CHCO's Facebook page. So look for it there. We'll have all the details. Obviously, things are always different the second time around that they're introduced. There's always tweaks to it, so I will look forward to those details as well. I feel like I don't fully have them yet either. Premier Higgs said the reason for the need to do this is that we are at 31 people currently in the hospital with COVID-19. We are at a capacity that is now affecting other services offered, emergency rooms, and as well as surgeries. So until we can get under 10 people in the hospital, and that will require a lot of people signing up for the vaccine who haven't been vaccinated, we will have this emergency order in place, and I will post what that means on our Facebook page very shortly. I appreciate you watching with us today. I know that I spoke very seriously at the beginning of this conference about monitoring the comments, but I do also want to mention how much I do appreciate the vast majority of you who watch with us, who comment, and who are a part of the conversation with us, and have been the reason we've asked all the questions that we ask in these conferences, because they do really reflect who you are and what you are concerned with and what your questions are. And Campobello, I'm seeing lots of questions right now about the Campobello ferry. I will push for that again in answer to your issues on the island. But I do want you to know just how much you have inspired what we do here in a positive way, and that is why I don't think doing away with the comments and questions on our online portion of our coverage is something we really want to go ahead with, because I think 98% of the time it's positive. There's always a few people that make it more problematic, but we are doing our best to deal with that in a way that I think will be even more positive for those who come here for information going forward. So I appreciate you sticking with us through all this and watching with us here. I'm Vicki Hogarth at the CHCO News Desk. I will see you next time.